Hello everybody. Today again, another small important topic to increase awareness about mental health issues of the kid. So we will go to the pathological demand avoidance that we are discussing for the last two sessions. Now I'm going to that assessment. So it is a part of most of the cases of the autism. So an autism assessment is important as it gives an accurate diagnostic level and identifies the specific support intervention of that person that may require. So currently, although it is recognizing that American diagnostic manuals that PDA means pathological demand avoidance as a separate diagnosis or a subgroup within autism spectrum. There has not enough research for this to be used as a diagnostic term, but some clinical diagnostic teams do describe it as a profile that they may recognize within the autism spectrum. The recognition of needed has been found to be helpful when signposting to other professional for support. So from an autism assessment, it should be possible to get a detailed profile of the child's strength and need, regardless of whether or not they recognize the term PDA. PDA profile is identified following a diagnostic assessment for autism, and it usually by multidisciplinary team actually, combination of the professional like pediatrician, clinical educational psychologist, psychiatrist, speech language therapist, occupational therapist, all will be involved to diagnose this. To begin the assessment process, ask maybe from the GP, they will be giving that properly to just for assessment referral, but also maybe community pediatric team if involved, they can also do that. So basically, these are the few things that that needs to be done. So with the detailed profile, support can be tailored to all aspects of life, like home, leisure, education, work, and should be regularly reviewed as the child's needs may change over time. PD is not currently recognized as a standalone diagnosis, so it is even more important that very clear description is needed and strengths so that support and strategies meet the child's need at that time of life. So this is really very important that we must have this very detailed informations when this PDA diagnosis we are thinking about. And getting a formal diagnosis can mean access to support, but having a specific profile for child's strengths and differences is the key to getting the right support. So it is really important that actually, so there are different approach and strategies for parents. Many parents find some of the recommended strategies with autistic childs are not effective for the childs with PDA profile. So these may therefore need adopting. When supporting a person with a PDA profile, it is very important to understand that they are not deliberately choosing to oppose you. They are having difficulty adopting and overcoming their need to be control of their environment. Having the right support therefore mean their trust and self-confidence grows, and with it their ability to cope with flexibility with the everyday demand of life. So it's really very important, isn't it? In education, most important reason for distinguishing the demand avoidant profile from other condition and autism profile is to ensure the child is supported by right educational approach. And people with profile don't usually respond to structure and routine, and indirect style of navigations will mean they feel more in control of their learning and consequently less anxious. So it's a lot of things needs to be done for them, isn't it? So basically this is a little bit of information to increase awareness. So I think hope this increasing your awareness, and if you find any your child's it's have any symptoms or any other child, then you can help them. Hope these little tips will help, and have a good day, and have I think